Hi, good morning, everyone. This is Saurabh Agarwal. I'm the director for Heart Care Foundation of India and moderator for these international meetings. Today, we are on 4th of September, 9:30 a.m. Indian Standard Time. And I welcome all the dignitaries who are joining in from the different part of the world for this education meeting. And I welcome you all. So today we have the country updates on COVID. So we are actually seeing a lot of variation between different countries on this third or the second wave of COVID. And we would like to have these updates from the horse's mouth, from the country representatives themselves. I just want to acknowledge again, one member over here who has lost life is Dr. K.K. Agarwal. Tomorrow happens to be his birthday. We are not meeting tomorrow. So it's just a special acknowledgement on his initiative of starting these meetings about 74 meetings back. So this is the 74th session. He was the president that time. And he took an initiative to bring all the countries and the think tank together to fight this pandemic. And successfully, we have done very well. We have bring to consensus statements during this COVID time when people realized that there was not enough information and enough resources to understand what is happening on this COVID. So what he did was he bring all the national associations together and created a think tank to understand what's going on in a different situations and a different country and a different environment, which helped us to fight this COVID. And a lot of people got benefited. So I welcome you all, and I thank you for this initiative for him, and I wish him a very happy birthday on one day in advance, since we're not meeting as a CMAAO thing. Coming back over here, I would like to acknowledge all the members during this time who have joined these meetings, starting with Dr. Chong, who is happened to be the chair of CMAAO and from Singapore Medical Association, Dr. Ravi Naidu, Malaysian Medical Association, past president CMAAO, Dr. Nazmi from Pakistan and president from PML Lahore, Dr. Alvin Chong, Dr. Alvin from Hong Kong Medical Association, Dr. Pillay from India and member of World Medical Council, Dr. Salma, president of Pakistan Medical Association, Dr. Angelica from South Africa Medical Association, Dr. Jamaluddin Chaudhary from Bangladesh Medical Association, Dr. Akhtar Hussain from South Africa Medical Association, Dr. Mukti from Nepal Medical Association, Dr. Subramaniam from Malaysian Medical Association, Dr. Sajad from Pakistan Medical Association, Dr. Benito from Philippines Medical Association, Dr. Prakash from Nepal Medical Association, Dr. Deborah from Brazil Medical Association, Dr. Marie from Japan Medical Association, Dr. Russell from Australia, UNESCO, Bioethics Chair, Dr. Shashank Joshi from India, Dr. Bukhari from Pakistan, Dr. Brahm Vasudev from US, Dr. Monica Vasudev from US, Dr. Sanchita from IGCP Group, Dr. Meenakshi from HCFI, and various other members who have joined this meetings over the last 74 sessions. I would like to thank you and acknowledge their presence. And now we will start with the country updates. I will start with Dr. Sajad from Pakistan Medical Association. Over to you, Dr. Sajad.
Okay, thank you very much, Dr.
Saurabh. Just a bit, Dr. Sajad, Dr. Saurabh, I can see the new faces, some new names. Can you just introduce them? I don't know.
So there are people who are joining in from Singapore, and these are the invited guests. And Mr. Chong had some group. He refers the meetings to them sometimes. Anybody who is from any association, kindly announce your name. Is that somebody who I missed out? And even if you are not from an association, kindly introduce yourself. I think that would be good.
Okay, I think, Saurabh, whenever anybody would like to discuss or
sure.
say something, they can introduce first himself.
Yes. So the meeting is open for everyone. You can start. You can talk, and we'll start the update. Yeah.
I start myself. My name is Dr. Kaisar Sajjad. I am Secretary General of Pakistan Medical Association. As requested by Saurabh for country report, in Pakistan, we are facing the fourth coronavirus problem, and it's very much lethal. Rather, we can say the death is more in Pakistan with this fourth wave, and but it's not increasing from the last 2 months. Sorry, from the last 2 weeks, it's constantly between 6 or 6.5% of the positivity rates. And the death is near about 50, 60, 70. 1 or 2 days, I just saw that 100 people died in Pakistan. But usually the death rate is 50, 60, 70, near about. And from few weeks, we are observing that children are now having this coronavirus, and they are not so serious, but few are admitted in the different hospital in Pakistan, particularly in Karachi. This is the situation, and the vaccine, regarding the vaccine situation, near about 35 to 40% of population have been vaccinated till now. And although the vaccination process is accelerating, not so much we can say that it's very fast, but it's good, but it should be accelerated more so that we can get the herd immunity as early as possible. And the government is trying to vaccinate everybody. The government and the other people and the Pakistan Medical Association in convincing the people to just have the vaccination to you and your family and your every dear and near. So the campaign is there, campaign is going on, and the people are now visiting the vaccination centers in a large quantity, in a large number. So we hope that we can have this herd immunity in Pakistan, and more people were vaccinated in 6 months maybe. So the vaccine we are using here in Pakistan, the government is giving their people free of cost. They are not charging any fee. The vaccines are Sinopharm, Sinovac, CanSino, Parkvac, Moderna, Pfizer, AstraZeneca, and in the beginning it was also people are also vaccinated with the Sputnik. So this is the all about, and we can say that more than 11 lakh people are infected in this coronavirus from the very beginning, and 10,000 no, sorry, I think 20,000 people have been died till now. So this is the situation in Pakistan with the coronavirus. We are still facing fourth waves. Thank you very much, Saurabh.
Dr. Sajjad, just one question.
Yeah.
Do you have an issue of halal regarding this vaccination in Pakistan?
Okay, good questions. But till now, there is no voice. No, I didn't heard anything about this word halal regarding the virus. But it is definitely there. The resistance or the vaccine resistance is there, and the vaccine acceptance is there. People are refusing to have a vaccine, and the government is imposing some ban, like the salary condition, like the hotel condition, like that shopping condition, and you cannot travel by air without showing the vaccine certificate. So this is this is the condition the government is imposing in Pakistan, so that everybody should get their vaccine as early as possible. And some of the province have imposed the, or you can say that they have given a target that their mobile SIM will be blocked if they are not vaccinated. So
Oh,
this
very
is
Oh,
so the people are very much they are running to get their vaccine. They don't want to block their SIMs. So
good.
this
oh
is
yes,
a
sir.
good.
That's very good. Sajjad. Oh, Dr. Sajjad.
Yes, thank you. Yes,
Dr.
yes,
Dr. Sajjad, just an additional question. Actually, you are mentioning that already 30 to 40% people. Is it 30 to 40% people are already vaccinated? You're telling?
no, 40%.
40%.
Rather, I can say the more than 40% people
How,
have been
how,
vaccinated
no,
till
no,
now.
how much it is given per day? They have reached good, very
Yeah,
good.
yeah,
Very good.
it is almost the average is 1 million. But day before yesterday, they have given 1.5 million a day.
Wow,
Uh,
per day,
Oh,
per
very
day.
good.
Wow.
per day. Yes, yes, they have they have recorded it, and
Yeah.
the health ministry have announced that in day before yesterday we have given a 1.5 million vaccine to the people. They vaccinated to the people, and which is very good. And even they have aim to accelerate. They want to accelerate this number, maybe 2 million in a day.
That's good. That's good. That's good. So you are mentioning the travel. Is it that you have travel inside the internal travel also included here, and the
Sorry,
restriction?
I can't get you, Jamal.
Internal travel. Internal air travel. Air travel is also included in the restrictions.
Yes,
That's good.
internal traveler in air traveling, in the intercity bus traveling, intercity, whatever the traveling is, the people have to show their cards or certificate that they have been vaccinated. So this is being imposed in Pakistan, and it's improving. The people are more and more coming to the vaccination center and getting their vaccines. So this is very good. And as a Pakistan Medical Association activist, we have been demanding that in the beginning, where it was only 50,000 or 60,000 per day vaccinated, and we have been demanding that it should be more than 0.5 million. Now the government is, we are pushing the government that this is very less. You have to go above 0.5 million. Now the government is doing the 1.5 million. It's very good. And the government and we are awareing people, and we are requesting the people, and we are aware people that this is very, very important to vaccinate themselves. And in Pakistan, we forget to tell you that the 85 to 90% people are infecting who have not vaccinated. Only 10 to 15%, only 10 to 15% people have vaccinated, infected with vaccine, and they have a little small symptoms. They are not severe. Few of them, maybe 1, 2, but mostly those who have non-vaccinated are infected more, and they are dying also. So this is very unfortunate, and I would like to have the other countries that doctors are also affected in about total we have 223 doctors have been died till now in Pakistan, and 31 paramedics are expired in Pakistan, which is this data is formed by the Pakistan Medical Association, and we have been advising to our healthcare workers to take a good care of yourself, so that you can be safe from the coronavirus. One thing more, this is my and Pakistan Medical Association observation, that out of 223 doctors died in coronavirus, hardly 20, 25 or 30 doctors were those who were working in the Corona ICU center. But most of the doctors are those who have who are anesthesiologists, who were ENT, my profession, my subject, ENT, I, general practitioner, physician, dentist, they are more affected as compared to those who are working in the corona ward, because they are taking more care in corona ward. And we as a ENT doctor, we are very much careless, and we saw patient with a close distance, and we examine the patient in a close distance. Similarly, the dentist, the anesthesia, anesthetist and everything. So my request is to everybody should be very careful who are not in a coronavirus but are in profession. They are examining the patient, but you never know the patient who are examining who is a carrier of corona or who is infected in the in coronavirus. So this is very, very important. Everybody should be very careful.
Dr. Sajjad,
Dr. Sajjad, can I ask one question? How do you decide which vaccine who will get? Because you got so many varieties of vaccine, even Sputnik. That's one. Second thing, do you have any statistic which vaccine have more side effects? Thank you.
Oh, very good. Thank you very much. Actually, Pakistan government have provided in the beginning the Chinese vaccine Sinopharm. Whichever is available, we insist the people that please don't demand that we want to have this Moderna, Pfizer. Don't ask for the vaccine. Whichever is available in your center, just go and get that vaccine. So mostly in Pakistan, we have the Chinese vaccine, which is Sinopharm and Sinovac, and CanSino or Parkvac. So mostly this is, and then Pakistan have facing this problem that with this vaccine you cannot enter in some of the country. So you have to have this Moderna, Pfizer. This is then government procured these all medicine and vaccines, and then people are getting these vaccines whenever anybody is going abroad. So they can have this vaccine. Now the Moderna and Pfizer is also procured by the government, and in few centers they have available, and the government have given the in few centers the Moderna and Pfizer and AstraZeneca for those who are going abroad, so they can have this center freely. They just go and show their traveling documents, so that the center will vaccinate you. And in between, it was so much in quantity Moderna and Pfizer that the center is giving to everybody, whatever the people are coming. And at that time, the Pfizer, what Chinese, the Sinopharm and the Sinovac were not available. So at that time, the Moderna and Pfizer were available. Now the questions of side effects, we didn't find any serious side effects or mild side effects mild to moderate side effects in Chinese vaccine, like Sinopharm and Sinovac or CanSino, Parkvac. Even Moderna and Pfizer vaccine, we don't have any serious condition or serious or death in after having the vaccine in Pakistan. Yes, we have few deaths with Pfizer, with Sinopharm after having again a coronavirus, and after that they died because of any reason, that they vaccinated with the Moderna, they were vaccinated with Pfizer, Sinopharm and Sinovac. Even then, after getting this virus, they died because of we don't know, carelessness or the not properly treated, whatever it is, or reaching to the hospital late. So this is the situation, but I didn't get, or I don't have any report that the serious side effects have been developed with this vaccine in Pakistan. Right, sir. Thank you.
We also have Dr. Salma. So if she can have a quick addition of what is happening in Pakistan also, so that we can take it. Dr. Salma, are you there? Dr. Salma, can you unmute yourself?
Okay,
Okay.
Saurabh, I just add something, and this is a request I have already requested in the CMAAO meeting, I think 1 month back, that please, I think this CMAAO should write a letter to the, I forget to mention in the CMAAO meeting yesterday or day before yesterday, that the vaccine which is available in which is recognized by the WHO should be accepted to all over the country. It should not be mention any condition that those vaccines should be the people are coming in our country should be vaccinated with the particular vaccine. So I think the vaccine which is recognized by the WHO, that should be accepted to all over the country.
Dr. Sajjad, actually, in addition, actually, you see, you are using mostly the Chinese vaccines.
Yeah.
Actually, do you confirm that the suspicion regarding the effectivity of this vaccine should not be considered, or it should this suspicion? Suspicion about the effectivity, because you are telling
activity.
Yes.
No, I think the effectivity is confirmed in Pakistan as well as in China, that the people who have been vaccinated with this Chinese vaccine, like me, my wife, and my other doctors are vaccinated with Sinopharm in the beginning. They are very much safe. They don't have any severe side effects, or they are now very much fit. Even I know some people, they are vaccinated with Sinopharm. They are not using mask even. I don't know, and I insist them. They are doctors. And why you are not using this mask? You are examining the patient. Or they said then, oh no, it's okay, no problem. We are vaccinated. So it is our experience and observation that the Pfizer vaccine, the Sinopharm and the Sinovac is very much effective in Pakistan. I heard and I read an article somewhere that the Sinopharm is very much effective even in the Delta variant also. So
what about the breakthrough infections? If you just judge what portion of the breakthrough infections take the Sinopharm vaccine? Breakthrough infections. In the breakthrough
which infection?
What percentage? What percentage?
Which vaccine?
What percentage did Chinese vaccine occupy in the breakthrough infections? Breakthrough. That means those were vaccinated but getting the infection.
Yeah. I told you it's only 10 to 15%.
But within that 15%, how much is the vaccinated the Sinovac, Sinopharm, or Pfizer, Moderna like that? Did you find out?
Yeah, it's only near about I mean, the 10 to 15% of people who have been vaccinated with Sinopharm and Sinovac, they are infected.
Okay.
Very little amount.
But Dr. Jamal and Dr. Sajjad, what I would like to stress here is, I think we should not decide on which vaccine. As long as WHO has approved all these vaccines, I think we go by WHO instead of we trying to decide which vaccine is good and which vaccine is no good. I think I tend to agree with Dr. Sajjad that all vaccines should be taken as equal at the moment.
Exactly. And people should know that every vaccine is effective, so that people cannot demand just like a market that I need this, I need that. They should go to the vaccination center and get vaccinated, whichever is available. So people, if we say that this vaccine is much better and this vaccine is much better, then the layman people and the general people demand that vaccine, that we will get vaccinated with this vaccine. So I think this is our responsibility to tell people whichever is available, please get vaccinated as early as possible.
So thank you, Dr. Sajad. I welcome our chair also, Dr. Chong has joined, and I would like to invite Dr. Prakash. He is having another meeting, so he has to leave. So I would like to invite him for the country update.
Thank you, Dr. Saurabh.
Yeah.
And good morning to all the CMAAO members and the participants. Most of the queries and the discussion went long. And
Dr. Prakash, can you introduce yourself? What we are doing today is
We like to see your face too, Dr. Prakash.
just introduce yourself and start talking about the country update. Now, we want people to update because I think there are a lot of changes happening. So we would love to have the designation. Oh wow, that's a good background.
Okay.
Then myself is Dr. Prakash Budhathaki, Central Treasurer of Nepal Medical Association. And first, I want to wish Dr. K.K. Agrawal for the happy birthday in advance, and welcome to all the members, chairs, and all the persons. And in the same time, I want to thank all the members because most of the discussion and Dr. Sajad has answered most of the queries. That's why I don't have to talk in detail also. Just I want to do my country, that is Nepal's update, because till now we have done 39 lakh PCR test and 5 lakh antigen test. In that case, 7,67,000 is PCR positive and 84,000 is the antigen positive. And we have a recovery rate 94.3%. And till now there is a death of 10,809. That means the case fatality rate is the 1.5%. And in the vaccination, in the last 1 month, we have done the good effort and the good achievement also. That's why almost more than 1/3 of population got the vaccine. They tested the vaccine or they got the injection of vaccine, but 16% got the full dose, and almost 70 to 20% got the single dose only. And we have vaccines from different countries, that is from China, Verocell, from India, Covishield, from Japan, UK, AstraZeneca, from US, Johnson & Johnson. And the government of Nepal, with consultation with the Nepal Medical Association, they have decided the priority list. On the basis of priority, we are giving the vaccines. There is no choice. And in the same time, those persons who are migrating to abroad, we are giving the vaccines based on that country's acceptance. Like if they are going to the Gulf countries or the US, they are getting the Johnson & Johnson. If they are going to the next countries, if that is AstraZeneca, then if they are going to the China, Taiwan, and other countries, they are getting the Verocell. And in the last 24 hours, there is a new cases are 1,756. Among that, PCR test is 1,357 and antigen test is 399. And the recovery patient is 2,274. And the vaccinated are almost 2 lakh. And the death is 23 people. And active case is 33,000. Among the active case, 30,000 are in home isolation, 2,300 is in institutional isolation, and 500 people are in ICU, and 100 people are in the ventilator. in now 40% people are female and 60% male are infected. That's why in the vaccination in last 1 month, we got so many rush to get the vaccine, because in Nepal there is no misbelief, there is no some distrust to the vaccine. That's why we are getting so much vaccine drive or vaccine hunger from the people. That's why the vaccine coverage is almost good. But in the same time, we did the zero prevalence study also. In zero prevalence study in Nepal, almost more than 2/3. That means 68.9% they got the antibodies against the SARS-CoV-2. That means almost 15% they got the vaccination. Remaining people, they got the infection in first wave or second wave. That's why still we are doing the vaccination program. I think in near future, if there is no new variant, we might get the herd immunity also. We are hoping for that also. In Nepal nowadays, there is no lockdown. Just 1 week before there was a soft lockdown, but since the few days back, there is no lockdown. But in everywhere, in every place, we are forcing to follow the public health measures, either in cinema hall, either in public places, either in hospital, in everywhere we are forcing in the public health measures. And hope so, if there is no new variant, we can cope with the corona. Thank you.
Dr. Prakash?
Yeah.
Mr. Chair, can I ask Dr. Prakash some questions? This is Alvin from Hong Kong.
Yeah,
Dr. Alvin Chen. Yeah, sorry, I had missed your point just now. How many percent of those infected have been vaccinated? You mean in Nepal? The coverage is good, right? What is the coverage percentage now? And the infection seemed to show that now the vaccines are not 100% effective in protecting the asymptomatic and mild cases. So when you said that in Nepal, the percentage of some percent, I couldn't hear it. Sorry. Could you please repeat?
Yeah. We can say the breakthrough infection. The breakthrough infection after the vaccination of 2 weeks is very less. That is almost 1.5% only. But most of the infection before the 2 weeks, they got the vaccination, but before the 2 weeks, they got the infection. That is almost 5 to 7%. That's why when they got vaccinated during the vaccination crowd or vaccination line, or they thought that they got the shot of vaccine. That's why they can go anywhere and they cannot wear the, that's not necessary to wear the mask. They thought that way and they got the infection. But once the 2 week is covered, after the vaccination, there is only 1.5% breakthrough infection is there.
I see. So it's quite effective in protecting.
Yeah.
Only 1.5%.
I also see in Nepal that, fully vaccination people are higher than the single dose vaccine. So I think the people are getting the second vaccination very high.
Yeah.
The ratio between first vaccination and the second vaccination is very less.
Yeah.
So it's good that, people are getting vaccinated in Nepal. Thank you, Dr. Prakash, for the kind update. Dr. Chang, would you come up on the floor with me? So can I invite Dr. Jamaluddin Chaudhary from Bangladesh?
Thank you. Thank you, Chair. Actually, I was just talking to you. Sorry. Thank you so much. Actually, first of all, I must congratulate our Chair, Dr. Chong, for his re-election, and also Dr. Alvin from Hong Kong. He has been re-elected as treasurer, and also
please introduce yourself, and then we can.
I am Dr. Jamaluddin Chaudhary from Bangladesh Medical Association.
Okay.
So I must congratulate also Dr. Martin Pillai to be our advisor, senior advisor. So first of all, actually in Bangladesh, I must say that the number of infections has reduced actually. Although we are completely open, social gatherings are not allowed, but social and political gatherings are not allowed. But everything is open, from the shopping mall to everything. The tourist places also are open, but they are asked to maintain the social distancing, the other behavior, everything. Okay, but I don't think so. The people are maintaining that, and that is not also surprisingly. I see the law enforcement agencies, authorities also are not caring that also. So, but I'm surprised that the number of evictions are getting day by day, it's getting lower, and now it is per day it is less than 3,000, and of course the infection rate is near about 10%. 10% of the tests. But you know, in Bangladesh, we see less tests. So far, only 9 million tests have been done. So it's very less. 90 million, sorry, 90. No, sorry, 9 million. 9 million tests have been done. And this is actually is very less, you can say. So now the vaccinated is double dose vaccination is only 5%, and single dose is having more than just 10%, just above 10%, So it is surprised. I don't know what is the answer. When there is no restrictions, movement and others. So why it's getting down? Even you can claim that vaccination number of vaccinations also so much increased at that kind of stress. So it's not answered actually. I don't know whether it is the natural decline or the losing this efficiency of the virus itself. I don't know. So this is the condition here in Bangladesh. Thank you so much.
Thank you, Dr. Chaudhary, for the Bangladesh update. Can I invite Dr. Ravi from Malaysia?
Thank you, Saurabh. My dear colleague, Dr. Chaudhary, I would like to congratulate Dr. Chong, who has been re-elected as chairman, Dr. Koka Chai, vice chairman, Dr. Elvin Chan as treasurer, and Dr. Martan Pillai as one of the advisors. Thank you very much for your wonderful job. And also the new team, the president is from Taiwan. The first vice president, of course, is our dear Dr. Sajjad. And next year, we will all hopefully be in Karachi. And the year after that, probably in Dhaka. We hope things will improve so we can all meet together in person. Well, as for Malaysia, things are still not very good. We are still in the 20,000. Yesterday was about 19,000 cases. But the government is very pleased to announce that we have till today vaccinated 60% of the population. They plan to make sure that by the end of October, 80% of the population will be vaccinated and there will be loosening of the conditions. Right now, we are in a lockdown. There's no interstate travel. They're allowing dining in only for 2 people at a time and only those who have been fully vaccinated 14 days post-vaccination. And so what's happening is more people are going for vaccination. Of course, we have that small group on anti-vaxxers. I did ask Dr. Sajjad about the halal issue. We got a few are talking about the halal issue. But overall, I think our progress is extremely good as far as the vaccination goes. While I say that, I must inform that we have had a total number of 1.8 million cases who are infected. And we have had about 17,000 deaths so far. But since the vaccination, we have had no major problems, in the sense we have had no deaths due to complications of the vaccination. We have had minor complications like, giddiness, vomiting, and, body ache and those kind of things, But generally, the response has been fairly good. Like I said, the vaccination here, they're giving Sinovac and Pfizer and AstraZeneca. We have had no problem with any of these vaccinations. We are looking forward to be able to travel within the country, which the government is attempting to do by end of October. To travel out of Malaysia, well, we hope by the end of the year, things should be better with the vaccination. Otherwise, there's nothing much to report from Malaysia. Thank you.
So I will just also show the graph of Malaysia. I'm also, the reason I'm showing the graphs today, I'm also showing the new cases. So Malaysia is pretty bad still.
Yes.
The death and the vaccination. So these are the three graphs. And if you see, this particular top line is the first vaccination, and the dark green is the fully vaccinated.
Yes.
So again, the difference in Malaysia is very less. I think in Pakistan, it was very high. In Nepal, it was pretty good. So it just gives you a fair idea of what's happening in the different countries. So, Ravi, this is pretty much first or the second wave, I believe.
No, this is the third wave.
Okay, but yeah, okay. So this can be the second wave over here. Yeah.
Yes. We are in the third wave now.
The third wave has been a bigger wave for you.
Yes, one of the worst.
One of the worst, yeah. This is the same thing which India had suffered in the second wave.
Yeah.
Dr. Ravi, you are telling that you have already vaccinated 60%. But
yes.
Why the number of infections are so high still?
Yeah, that's a good question, because what's happening is these numbers are high among the non-vaccinated people. And the other issue that I did not mention is we have a lot of migrant workers in this country. So now the government has taken the trouble to even vaccinate the migrant workers. That means those who are documented. Those who are not documented, we have approximately about 3 to 4 million in the country. Wow. And the problem with the undocumented, the government, though they promise them, you come, we will not arrest you. But there have been certain places where they were arrested. So all the undocumented workers are frightened to come out for the vaccination. So that could be one of the reasons for the spread. So this is actually worrying, because we, the Malaysian Medical Association has asked to give vaccination for everyone, immaterial whether documented, undocumented, because this will be for the safety of the people of Malaysia, But you know how the government works sometimes,
Thank you, Dr. Ravi. Can I invite Dr. Russell from Australia? Can you please introduce yourself and let us know about Australia?
All right. Okay. Nice, a very good day to all of you. From Australia, Russell D'Souza from Melbourne. We are continuing with dealing with the Delta virus here. And I think what's happened is New South Wales, Victoria, and the cases are still going. I mean, it's probably New South Wales was about 1,500 today, some 4 deaths. And Melbourne was 190, but no deaths. But they've decided to keep this locked as we are till around September, when we reach 70% of vaccination. So at the moment, vaccinated, that's the thing that's happening. I think we roughly around 70% have had the first dose, around 40 odd percent have had the complete both doses. And now there is some increase in the supply of the Pfizer. There's been some issue with hesitancy for the AstraZeneca, which was, initially we had some problems with clotting, and also it's recommended for above 60. So now there was some lock with regards to Pfizer, but it appears Singapore and UK and others have loaned, and so that's coming through. And now today, I think they've just accepted Moderna. That's also coming here. But today the TGA has approved it for till 12 years, 12 to 16. So they're going to start vaccinating 12 to 16 here. And what it appears to be, even in Greater Melbourne, which is it's 42 and 48% of the active cases are in two areas. One is western part and the other is northern part. And so it looks like that. And they've also looked at majority of the cases have come from schools, children infecting the adults in schools, and the other one from child care centers. So it appears the two places have contributed to, so schools are continuing to be closed, and I think they want to open for the 12th, but they want to bring this the vaccine for 12 to 16 years. They're going to start that, I think, sometime this month or so, but it's just been approved. With regards to the other part of Australia, most of it have no cases there, but we've got all our borders blocked, so we can't move to each state is locked like two different countries. Of course, for Victoria, we're still I think till we reach 70%, they're not going to continue with this lockdown. Some minor relaxing has been there for children to come to the parks, and other than that, the other thing is that they're bringing in QR code combination with your vaccine certificate. So probably when we reach 70, those who haven't been vaccinated will be locked out, and they can't enter places, they can't go to restaurants, they can't with the case. So it's going to be linked to it's already there, linking it to the QR code. So when you go to either restaurants, sporting events, or most places, yesterday they've already informed that they're going to be, those who don't get vaccinated will be locked out of most places. So that's, they have a national cabinet that meets, and this is the way out. Yeah, so that's pretty much what's happening in Australia. As you know, we never had much of a problem with the previous, it's only the Delta that has caused this fair amount of problems. New South Wales has had about 100 deaths now in this, over, I think yesterday 4, but I think a few days ago they had 12. But again, what is coming out very clearly here from at least what they're showing us is that all the deaths are predominantly those who have not been vaccinated. And even the cases, they're showing hospitalization also has been for either most of them are not, a few have come who haven't had only one dose. So the strong evidence we're getting from what's happening here is whether it didn't matter whether you had the AstraZeneca or the Pfizer vaccine, both seem to be preventing hospitalization and death, certainly. That's what we are seeing. So that's as far as Australia. Thank you for that.
Thank you, Dr. Russell. Can I have Dr. Matanda Pillai?
Yeah, thank you. Let me also pay homage to K. Agarwal, and then coming to the situation in India, a vast country like India, statistics don't have much value, because if you look at the total number of cases in India, it is 45,000, and 35,000 are from one state, southern state of Kerala. So the variability is there. If you move out 4 states, then we can say that the second wave is over, because in Delhi, there is hardly 352 cases, and there has been no deaths in the last 1 week. So this variability is there, and the statistics get confounded because of this variability. But generally saying, the caseload is mainly from Kerala, which forms about 69% of the total caseload. Maharashtra 14%, Karnataka 14%, Tamil Nadu 4%, Andhra 3%. So that is it. All the rest of the states, it is hardly in 2 digits or 3 digits cases are there. And of course, definitely the third wave we are anticipating, and preparation to combat it, particularly if it involves children, the children hospitals and setup is definitely activated. Then, of course, the national level test positivity is 2.7%, whereas in Kerala, where you have the maximum number of cases, the positivity, test positivity is 18%. One good news is that the vaccine we have been able to give to 67 crores of our population. That means 50% of our population has 1 dose or 2 doses by now. But then because of the Delta variant, even to get herd immunity, normally 60% are vaccinated, herd immunity will set in. But with the variant running around, it has to be almost 85% has to be vaccinated, and the zero positivity has to be almost to that extent. And so we had to go a little more to attain herd immunity, if it all it is going to happen. The process of vaccination started on 16th January 2021, and almost in less than 8 months, half of the population has been vaccinated, and maybe by the year end, we'll be able to vaccinate a good number of our eligible persons who definitely are to be vaccinated. Now the lockdown is not there almost practically, but certain areas, of course, confinement zones are declared, strict confinement zones are declared to contain the infection, but a general lockdown is not existing. And schools are reopening in many states with precaution and with all precautions. And then, of course, on the vaccine front, last time I said that the Cydus Cadila Pharmaceuticals have come out with the plasmid DNA vaccine, which has been tried in children up to 20 years, and it has been successful. And the drug controller has given emergency sanction for emergency use. Another company, Biological Events, have come out with another vaccine. So vaccine, apart from the existing 2 vaccines, 2 more are being manufactured in India itself. And if those come into market, maybe in 1 year or 1 month or so, even up to 12 years, the vaccination process can be extended. So that is the good news. Then globally, when you look at it, a new variant, C12, has been detected in South Africa, and it is to some extent present in Bangladesh, New Zealand, and Brazil and other countries. So the air travel, more restrictions have been placed in India, because the test RT-PCR has to be done, and it has to be negative, and 1 week of quarantine for all who come to India is in place now. More stricter regulations are there. Another good news at the international scenario is that Brazil has come out with a molecule from cobra venom, a molecule of the cobra venom, supposed to be sort of inhibiting replication of the vaccine. And this molecule can be produced in the laboratory setting. It has been tried in animal cells, and it is effective against coronavirus. And this is very initial stages. Maybe if it becomes successful in human experimentation, then we have a solution to contain COVID vaccine, corona infection. So this is in short what I have to brief you regarding what is happening in India. Thank you.
Thank you, Dr. Pillai. In fact, yes, there is a big controversy going on about the school colleges over here opening in India. Because we haven't started the children vaccination in India, right? Yet. And it would take about a good 6 to 8 months to get them vaccinated. So Dr. Chong is back from the emergency. So Dr. Chong, why don't you start an update in Singapore? You've always been the last person to do it.
Oh, thank you. I'm so sorry. I was away. And by the way, I also had my Sinopharm booster today. This morning, I took a Sinopharm booster because my CPAS antibody, that's the neutralizing antibody, is low. I did my Pfizer in January, February, you guys recall. So my CPAS has my neutralizing antibody has dropped now down to 48%. We want it to be 68% and above for convalescent serum donation and 80% and above for Delta. So at 80% and above, if you are face-to-face with a Delta patient, you're unlikely to catch the infection. So that's where I am. And because we don't have a booster for Pfizer and Moderna available yet, I decided to do the Sinopharm. Our practice brought in Sinopharm. So mix and match, as you know, the global consensus is talking about. So what's happened in Singapore is that we have hit something like 83% of the population have now been vaccinated with first dose and 80% with 2 doses. Now, if you look at the fact that 8% of school children, 8% of our population are school children. So that means 92% are eligible for vaccination. We have hit 83%. So we are almost there. We are closing in on the last 10% of people who are eligible for vaccination. And now we've also announced that as of yesterday, those who are 60 and above and immunocompromised will receive the booster. Unfortunately, I have not hit 60 yet, so I decided to do the Sinopharm booster. Otherwise, that's where we are. We're running at about 200 cases a day right now, and a lot of it is Delta. So, but we are still going ahead with the decision to open up the economy, carefully, of course. But we don't see us going back to a lockdown. And the only thing that we can do is to move forward and make sure everybody's vaccinated. So that's where we are at this moment in Singapore. Oh, one more thing. I would just want to let everyone know that yesterday at the CMAAO meeting, the CMAAO has agreed, CMAAO has agreed to back the Agarwal's, our recommendation for the Padma Bhushan Award.
Dr. Chong, you are just telling about the mix and match. Mix and match. Can you just enlighten us actually, because it's not yet recommended. It is studied, but it's not recommended. What about that?
Sorry, Dr. Chaudhary?
No, you are telling about the mix and match, okay? But it's not recommended by WHO. So how are you going with that?
Oh, yeah, I just decided to do a Sinopharm today because I'm traveling at the end of the year. So I want my CPAS antibody to be sky high before I go. That's where I'm coming from.
No, but I'm telling you, this is not recommended still because it is under the research still. So you have already gone for it. Okay, that's good.
But yesterday we announced in Singapore that we will be giving boosters, Pfizer or Moderna boosters, to the third shot to immunocompromised, and anyone above 60. So
Okay.
yesterday, our government has announced after opinions from experts.
Okay.
So that's where we are. We're closing in on that 92% target. 92% because 8% are children below the age of 12. So we are now at 83%. So we are less than 10% away from that final target. So that's where we're headed for. And then after that, I believe we can confidently open up the economy.
But Malaysia
what about the mix and match? What about the mix and match? No, Singapore.
The booster announced by the government is not mix and match. It is Pfizer or Moderna.
No, but I'm telling you, because it is asked actually several questions, how this is going on in Singapore, mix and match.
No. We are not doing mix and match in Singapore, only for myself.
Oh.
I'm doing it only for me.
Very special.
Okay, it's very interesting because in Singapore, we have the government program. We have the government program of vaccination. It's controlled by the government, Pfizer, Moderna, Sinovac. All right. So Sinopharm is not government program. So they allow private clinics and private hospitals to bring in any other WHO vaccine. So we managed to get hold of Sinopharm and directly into our practice. That's why I'm doing mix and match. But the government is not advocating mix and match. The mix and match, the booster program will be Pfizer or Moderna.
So Dr. Chong, in other words, these are privately brought in and sold. You sell it to the people, right? Okay, okay, that's good.
This is a private program. Yeah, so I just got myself zapped with Sinopharm. But that's because I want to travel.
Dr. Chong, there is a community spread case in Singapore which actually created a very hype. And so anything on that?
216 cases local transmission. But the ICU figures are okay. There are only 20 who need oxygen and 5 in ICU. So, I mean, because of our good vaccination numbers, even though we have 200 plus cases a day, but we have very little who need oxygen and very few in ICU. And those who need oxygen and those who are in ICU are mainly those who are not vaccinated. So clearly the vaccine works.
So Dr. Chong?
Yes, Alvin.
Dr. Chong, anyway, congratulations for the great success in Singapore. And I think it's marvelous to have achieved that goal, 82% out of 22% as a target. Wow, that's marvelous. And I'd like to ask 2 questions. Now, you mentioned that most of the cases of the 200 plus per day were mild and or asymptomatic. Only very few were serious or need ICU care. So exactly what's the percentage of these serious cases among the 200 plus per day?
We have, it's a very low percentage, you know, because that's, I actually have to share screen to show you, if you don't mind.
Thank you. Yeah, thank you.
Share screen to show you.
Percentage is high, I think.
Yeah, I can show.
5%.
Yeah, I just share screen to show you now. Can you all see this?
Yes.
Yeah. Okay.
Thank you.
So this is our latest update. You can see 3rd of September. And there are 216 cases. And this is the 83% and 80%. 83% received 1 dose and 80% have received 2 doses. So the target is 92 because 8% of the population are school children below the age of 12, right?
Yes.
So we're closing in onto the magic, almost a full vaccination soon, all right, we hope. And these are the figures that are broken down into the age group. So the ones we're very worried about are the gray ones, 60 to 69, and the black line, which is 70 and above. All right, so you can see we are closing in onto a very good percentage. You can see that 88%, 92% for these 2 age groups. All right, the younger people are all in their 90s. All right, so the only worry is this.
Right.
old. And then this is the, of course, this is a similar one. This is the figure of cases that need ICU. So that's 20 and 5. All right. And these are the daily case numbers. These are all the daily case numbers that need oxygen or ICU. So we report this on a daily basis. And
Right. That's great.
yeah, and then we break it down. We can break it down further into age group. Of course, you can see those who are 70 years old and above. The gray ones and the black ones are the older groups, right? So you can see there are more of the older folks. And intensive care, same thing. Deaths, same thing. All mainly the older folks because they're all black or gray. And this is the fully vaccinated figure. So those who are the local cases and by severity, those who are fully vaccinated, you can see the lines here. The purple line is oxygen. The orange line is here is ICU, and this is to answer Alvin's question. And the red line are deceased. So you can see from here, completely unvaccinated, 437 patients. 6% had 6% needed oxygen, 0.5% needed ICU, 0.9% perish. And those who are fully vaccinated, you can see the difference in figures. Right?
This is a good data. Can you take a screenshot and send it to the group also? This is a good data, I would say.
Yes, I will.
But this is only for 28 days, right?
Yes.
Okay.
I will send you the link now immediately, and you can go to the link immediately. And this is updated every day. You can look at this website. It's a ministry website, and I think this is just all the local. There's a lot of local data here that you can see. A lot of data, a huge chunks of data. And one interesting thing is here. This is something about quarantine. So we have people coming back from overseas. These are imported cases. And you can see in the last few days, right, in the last 1 to 2 weeks, we only have about 20 cases which were detected by through quarantine. So we're now asking ourselves, is there really a need to quarantine people when they come back? You know what I mean? You only detected 20 cases over the last 10 days, right? The yellow ones. So, a lot of people do quarantine when they come home from overseas, right? 2 weeks of quarantine. So the question is, do we really need to quarantine them? Or can we just do it at home? So that's where we are at the moment. So I'll send a link to this page and you can look through this. All this data here is very, very useful.
Dr. Chong, they're trialing a home quarantine in Adelaide. As
yes.
You know, where Sajad's son is in. They have just started that home quarantining. And if that works out, I think that's the plan down the track here also to go into home quarantine.
Yes, that's right. So, yeah, I'm trying to find the link for you all. Hang on, let me just refresh the link and then send it to you.
Okay, and we just have 10 minutes, so we just quickly move to the other countries after this. I think we have left with South Africa and Hong Kong, and everybody else. I think we covered up. Yeah. So can we move to another one? Okay. So can we quickly invite South Africa, Angelica and Dr. Hussain, Dr. Angelica and Dr. Hussain? Can we please invite you for, yeah.
Thank you so much. I'm quickly going to give you all just a brief more over South Africa and 1 or 2 things that came up during this meeting, and I'll leave South Africa to Dr. Hussain. I just want to draw your attention to published data from the 4th of September today, where it stated that only 2.5% of Africans are vaccinated. And the COVAX program seems to be a problem at this stage, and a lot of the countries can't or don't get the COVAX supplies because the COVAX was dependent on the Serum Institute of India And then, as we all know, the Indian government suspended the export of the COVID-19 vaccines when it started to struggle with with their own crises, but in India. So by the end of March, only 16 million dosages were delivered to 28 African countries. And then many of the African countries entered the third and fourth waves. We all know the hospitals that's been overwhelmed and all of that. And then even with financing, we saw that many of the lower income countries have struggled to purchase doses as demands outstrips the production. And what we're now seeing is that the vaccine scarcity began to improve in July, when African nations received more doses than that month from COVAX than the entire months of April to June combined. But the problem now starts to arise that the donated dosages began to arrive in the millions as the high-income countries are now starting to slightly loosen their grip on the supplies, and so that more is now being donated to Africa. But now it's sort of a dumping type of thing. We are afraid that within the next 3 months, it would be more a dumping ground. And the problem is that Africa still doesn't have the ability to roll out a lot of these vaccines. So this is a huge, huge problem. And they reckoned that in order to vaccinate 60% of the continent, and that we need to have, and that's 780 million people by the end of 2022, for us to reach herd immunity, we need to have more than 793 million more dosages than the 129 dosages that's already been received. And it seems highly unlikely. And a brief update on the presentation of population of the countries that has been vaccinated. The top 5 is Seychelles 71%, Mauritius 55%, Morocco 39%, Tunisia 18%, Cape Verde 12%, and on the bottom 5, Cameroon, Guinea-Bissau, Burkina Faso, Chad, and DR Congo. With less than 0.1%. So this is really a huge problem, and that will affect the rest of the world going forward. Then I just want to briefly mention, because it was not mentioned today, that India has approved the new COVID vaccine that uses circular strands of DNA to prime the immune system. This is administered into the skin without using an injection, and it seems to be 67% protective against symptomatic COVID-19 in clinical trials, and it seems that India will start to administer it from this month on. And they said, although the efficacy is not particularly high compared to that of many of the other vaccines, it is a fact that it is a DNA vaccine that is significant, so it's easier, as I've said, to administer, and the storage and all of that is easy, but it seems to be that they will have to administer 3 dosages. So we will need to see what happens here, and we would like from our Indian colleagues to give us feedback, because this is the first approved vaccine, the DNA COVID vaccine. And in India was the first one to approve it, fully approved it. And just a brief feedback on the, it was mentioned, the C1.2. According to the World Health Organization, it is not a variant of concern nor a variant of interest at this stage, but we did pick it up in South Africa, but as correctly said, it is in other countries as well. We are, however, in South Africa, keep an eye on this variant, because it might cause us our 4th wave going forward, but we don't know. Then also that is interesting is that India had also, I think, their first death of the Delta, the Delta 2 variant that we saw, and we don't know what the clinical picture of that variant here in South Africa. So that is the Delta Plus that I'm talking about. It was in Mumbai apparently. So if we can get the clinical pictures of the Delta Plus variant, it would all help us. Then I also need to say that new study published in the MedRevex preprint, but it's not yet pre-reviewed, states that the individuals had similar viral loads in nasal swabs, irrespective of vaccine status, during a time of high and increased prevalence of the Delta variant. So this is very important. So it seems that that even though you are being vaccinated, as we have discussed it this morning, that vaccinated individuals should continue to wear face coverings indoor and in congregate settings. Because if they are exposed or experience COVID-like symptoms, they might spread it. So the breakthrough cases comes also from people who was fully vaccinated. And again, we need to stress that none of these vaccines are going to protect you 100% against death or 100% against mild diseases. And I think if we can get that message out, but as you have also seen the stats that Dr. Chong gave us, that it do protect you significantly against severe disease. So again, it's very highly effective, that our vaccines, but again, we need to understand that even though you have been vaccinated, you still need to wear your masks. I think that is just in a time very, just very briefly in the interest of time. So I will ask Dr. Hussain to go give us a further update. Thanks.
Thank you, Chair. In South Africa, last 24 hours, new cases were 9,199, and the death last 24 hours was 247 cases. The South African total tested 2.8 million and 2.5 is recovered. Still, we got active cases, 145,000. In South Africa, we had total death 83,000. So our average testing rate is in public sector and private sector is 52,000 every day. Our positivity rate from 22%, it was last week, now it came down to 16.7%. And last 24 hours, 12,320 cases of COVID-19 admitted in 664 hospitals around the country. And 1,821 of them was in ICU, 1,029 cases was ventilated. And our case comparing with the Kerala, KZN, KwaZulu-Natal is the similar positivity and similar number of cases every week. So that's in short in South Africa. Thank you.
Thank you. Can I have Dr. Chang quickly for the Hong Kong Medical Association? And that's the last one.
So I'm afraid you have to leave now because it's already 1:30. You have another appointment.
That's
right?
fine. You can just give a quick update.
Every time I'm the last one, I don't think I have time to pass on any information here now. Okay, after Hong Kong, it's just a small place. I don't have anything to share with you right now. Even you can go to Google Hong Kong and you can see the COVID situation in Hong Kong. And of course, we don't have anything to share. Okay, I think it's okay. Because you can see from Google, we don't have any case for the past week. So that's nothing to share, okay?
So that's good.
Thank you very much.
That's very good, very good.
That's a good one.
It's nothing to share. Thank you very much. Bye-bye.
That's good news for Hong Kong.
Yeah, but anyway, a lot of things to learn here. And thank you very much. And I have to thank you, Ravi. You are the one who seconded me to be re-elected to be the treasurer. You know, it's a difficult job here.
Yes,
Treasurer. But then we need more wisdom. We need
Dr.
more
Arvind,
wisdom to deal with
yeah,
New Zealand colleagues. How to deal with the problem, you know?
For your
we
information,
all
the
have
three
supported you.
positions, the
We
three
all have
positions
supported
are
you.
for y'all for life.
No. We are going to I think we have to quit very soon. The Hong Kong Medical Association have to quit very soon. After all, I think it's good
What,
that
Ranjan?
CMAAO will
Yeah.
expand. Hopefully, could have some associate members, as suggested by Dr. Sajid, and that will need some new ideas how to go on with more membership fees and how the criteria would be for the associate members. But anyway, because also I have to have another meeting now. So anyway, thank God that we don't have anything to share because no cases in the past few days. Thank you very much.
That's really good.
Excellent.
Thank you.
So thank you so much, everyone.
Thank you. Thank you.
Thank you, everyone, for joining in.
Bye-bye.
Bye. Take care.
See all
Thank
of
you.
you.
Bye-bye.
See you again next week, same time, same
Bye.
day. Thank
Thank
you.
you.